Tonight, an update on an in-depth story that News Channel 3 first brought you a year ago. The state assembly has now passed legislation to help California hospitals become seismically retrofitted. As I reported, hospitals throughout the state need to be retrofitted by the year 2030 to help withstand a major earthquake. The measure was created in the wake of the 1994 Northridge quake that made nearly a dozen hospitals unusable. If hospitals do not meet the state deadline, they risk being shut down. The bill, co-authored by Valley Assemblymember Eduardo Garcia, aims to provide hospitals with grant assistance and allow delays for certain financial hardships. I spoke with Garcia today about what happens next. Eduardo, what is the latest right now when it comes to retrofitting our hospitals?
Well, look, a lot of hospitals in California are facing a deadline of 2030 to make sure that their hospitals will withstand, the big one, right? The earthquake that is constantly being predicted. And the cost of getting into compliance is really outrageous when it comes to what hospitals currently are generating and their financial circumstances. Our hospital in our region, Desert Regional Hospital, is facing a 2030 deadline and is facing a cost of anywhere between $120 to $180 million to become seismically retrofit and be able to continue to provide the critical care that they do. But we are working on legislation with Assemblymember Jim Wood to ensure that hospitals like ours have the ability to receive the financial support from the state to be able to move into the direction of getting into compliance. And if the resources aren't available, that compliance date be pushed out. And so the bill allows for some exemptions, but also some exceptions when it comes to the financial circumstances being made available for hospital retrofits.
So where are we in the process and what comes next?
Well, the bill is moving out of the assembly and now starts the process in the Senate. It's gotten a tremendous amount of positive support, both from urban and rural parts of the state where hospitals are struggling to keep their doors open. And with the additional cost of having to seismically retrofit these facilities, it's really one of those things where hospitals get really nervous about whether or not they're going to be able to keep the lights on and the doors open. And for us to be worried about hospitals closing at a time in which we got to make sure that access to healthcare services, particularly in rural areas of California, it's a fundamental right. And so we are working hard to make sure that the members of the Senate understand how important this piece of legislation is. We're very grateful to Assemblymember Jim Wood for allowing us to incorporate criteria into the bill that makes sense for the hospital in our region.
So if all goes according to plan, when would these hospitals get the money they need?
Well, look, we last year had a budget ask of $1 billion. There was some money that went into the budget, of course, not in the magnitude that we asked. We are looking to the state to ensure that in the process of addressing a number of different healthcare needs, that we put forward some money in this budget to be able to ensure that the rural hospitals that are in most critical, dire need financially and that have to meet this 2030 compliance are the first ones in line to get this money. The budget conversations are happening right now. We have to approve a budget by the 15th of this month. And then we also have the legislative process where bills have to be on the governor's desk by the middle of August and be signed by September. So we're excited on the support that this bill has received, and we continue to push forward to make sure that the hospitals in our district, particularly Desert Regional, get the support that it needs to become seismically compliant.
All right, Assemblymember Garcia, we appreciate your time. Thanks so much for joining us.
Thank you.